Namaste all, this is Dr. Meenakshi, MDIU, Balaroga. So today I am going to explain about the basic point of newborn care, that is the baby immediately after birth, what all we can care. We can take care or tips to the newborns, basic steps, what all a new mother can follow to take care of the newborn. So you all may be knowing, some few will be having knowledge that when delivery will happen, right? After 37 weeks of gestation, at any time till 40th week of gestation week, the delivery is considered as normal, right? And this is according to the medical field, but the common people, what they know is the gynecologist will give one date according to the gestation, that is pregnancy. According to that, ED will that is expected delivery date will be happening. Usually after 9 months, completion of 9 months, after 7 days or 9 days, they will give the EDD, that is 9 months plus 7 days or 9 days will be the EDD date, normal EDD date. So now we will stop the pregnancy part because our today's topic is newborn care, right? So immediately after birth, what will happen? The examiner, that is the pediatrician, immediately will check the baby. If any emergencies, they will hand over the baby to the NICU persons, or if the baby is normal, then they will hand over the baby to the parent, that is mother or guardian, right? What all examinations they will do? First of all, they will do the physical, whole body physical examination. Immediately after birth, the baby should have cry. This is the first sign that is baby is normal, right? So immediately after birth, the baby should cry immediately. Then after crying, they will test the Apgar scores, and they will give the vitamin K injection shot. Everything will be followed according to their medical procedures, right? After that, they will hand over the baby to the guardian or a mother if baby is normal. If there is any problems in a baby, like physical problems any, then they will go through the treatment. So next step is immediately after birth, what steps to be followed to take care of a baby. As they will clean the baby and they will give immediately, first thing is keep the baby warm with cotton cloths first, and the next point is handle the baby with care, because all maybe neck muscles, everything will be very sensitive in baby. So the next point is we have to handle the baby with care. We have to keep baby warm first of all. Then first foremost 2 points we have to observe is within 12 hours to 24 hours baby should pass the urine, and within 24 hours the baby should pass the meconium, that is first stool. If this baby passed in within 24 hours, everything is clear, then baby is safe. And however the baby is sensitive, it needs time to get adjust to the new environment, because the womb environment will be different for baby, and immediately after coming out the environment will be different. So you have to take care of a baby with very sensitive way. This and immediate first foremost point is within 1 hour or half an hour or maximum 2 hours after birth, you have to breastfeed the baby. This is the first shot of immunization what you are giving to your baby, that because the first breast milk, which consists colostrum, will be considered as a first immunization shot for the baby. So as soon as possible, when mother gets stable and baby gets stable, first thing you have to do is breastfeed a baby. This we have to follow immediately after birth. So next point we will see is within 24 hours, first 24 hours after birth, what all points to be carried out to take care of a newborn. First point, however, we discussed is we should handle a baby with care, and next point is we should breastfeed a baby on demand, or for every 2 to 3 hours we have to feed a baby, because first 3 months baby will get hungry. The baby needs the nutrition or supplement for every 2 hours. So though baby sleeps for a long time, you have to wake a baby and you have to breastfeed a baby for every 2 to 3 hours. First, next point. And the other point while breastfeeding is, usually you all maybe saw the newborn babies will get repeated hiccups. That is one of the functional of a GIT. Nothing to worry. You can burp a baby immediately after feeding, or if the baby is taking for longer time feed, for every 10 to 15 minutes burp a baby. Burping, how you have to burp and what is this burping, I'll make another video about the burping and steps of burping. So burping is nothing but you have to give the air movement for a baby after feed, so that the baby can take the regurgitation, that is the hair swallowed while feeding will be removed out. You have to see this point. And however, as I mentioned, the environment will be new for baby, so you have to give a comfortable sleep or comfortable bed or skin to skin touch for a baby. Skin to skin touch will be very useful for even your comfortable, I mean for mother comfortable and baby comfortable, and it will enhance the breast milk production also. So these all we have to maintain in first 24 hours of a baby. And another point we missed here is, however the baby entered a new environment, directly you should not bath. First 1 to 3 days sponge bath is okay for baby, so that the baby will get adjust to the new environment, new temperature. Then you can go for the bathing and all after 3 to 5 days. The only 4 steps have to follow for new mothers, that is, they, as usual, they will be not working for some days, they will be on full rest. So what is this 4 steps with baby you have to do? Cleaning, means diaper changing on time or the clothes changing on time for a baby. Playing with the baby is first foremost bonding which you are making with the baby. And sleeping, whenever baby sleeps, try to take rest at that time, because when baby will be awake, usually you will not get time, you need to spend time with the baby, right? So whenever baby sleeps, you too sleep with the so that you will get some rest time. And next thing is feeding. You should feed a baby for every 2 to 3 hours. Only these points you have to follow in new mothers, that is playing, sleeping, cleaning and feeding. And next thing, the baby sometimes it will give clues that he or she is hunger. What are those? Maybe the movements of a body, or the stretching of a body, or opening of the mouth and taking the fingers in the mouth, baby, one of the sign. These all will be early signs. Or stretching, random movements of a body, or head movement like searching for the feed. These all may be the mid points. And last, after these points, if we didn't recognize that baby is hungry, it will start to cry. At that time, first we have to calm a baby, then you have to give a feed. I added a slide, you can see clearly. And how to calm your baby? First thing is cuddle, means take a baby, make skin to skin touch, especially on chest, and talk to a baby. Though the baby won't react, it will understand whatever you are saying. So talk to a baby, then slightly tap on a back. When baby gets calm, you can feed a baby. And another one point all the new mothers will be having is how many hours the baby should sleep, right? Usually in newborn times, babies will sleep 16 to 18 hours a day. In 24 hours, 16 to 18 hours babies will sleep. But if you give a comfortable bed, comfortable feed and comfortable environment, babies will obviously they will sleep. And another thing, when babies awake, for how many minutes or hours baby will be awakened according to their age. These points babies will be new mothers will be having, right? So from birth till 6 weeks, babies will be awakened from 45 minutes to 60 minutes, then again they will go to sleep. From 2 months and above 1 month, for 1 hour they will be awake, for 1 hour gap they will sleep, and in 3rd month 1 to 1.5 hour. Like this only they will go on increasing, and at the time of 6th month they will be awake for 2 to 2.5 hours. In this gap they will play for 2 to 2.5 hours, and again they will go to sleep. This will be the sleeping routine of a newborns. And next point is, after birth, after 3 to 5 days, usually when you go shift to the home from hospital, you will start the routine paricharya, right? Like the routine follow of the newborn mother and baby, all will follow this according to culture, right? So nothing but the massaging, body massage maybe for mother and baby, and hot water bath, and dhupa they will give for in some culture. These all routine will be followed. These are some of the steps to care the newborn, right? So first of all, what the steps to be mentioned while bathing a baby, that is, first of all, it should not be hot water, it should be lukewarm water which can resist a baby's skin. Then massaging a baby, you can use a coconut oil, you can heat it lukewarm to indirect heat, and you can massage a baby. And soaps you are using which are for baby should be gentle, it should not be any alcoholic content or any other chemicals added, it should be gentle for a baby. First point, foremost basic point is, whenever you sit for a bathing a baby, all necessary things should be handy, you should reach it handy. And after bath you should keep a baby warm. This is bathing tips. Next, skin to skin care tips, like skin tips maybe, as I said, the oil or soaps whichever you use for a baby should be gentle, it should not be any chemicals added. And the folds of a baby should be cleaned frequently, especially during summer, because due to sweat maybe mud or powder, anything will be accumulated in joints like foldings, and it will convert to infections. So you should look after. And the powders or moisturizers whichever you are using for a baby, it should not be fragrant. Fragrance soap or powder should be avoided. And especially you should maintain diaper time, that is, after every 4 to 6 hours you should change a diaper, so that it will not become rashes for a baby. Diaper rash, you may be heard, right? For if in any condition, if the baby had diaper rash, then you can use a diaper rash cream, or normal coconut oil also you can use. And especially one point is, in skin care tips, sunscreen lotion should not be applied to a baby till 6 months. Sunscreen lotions are avoided till 6 months. So last point which I am explaining is about the baby care products. What all products the baby should use, we should use for a baby, that is baby powder. It's my advice, don't use any powder for a baby, because as I said, we will apply a powder and we will leave, but wherever like joints are there, the powder will accumulate there and it will create the infections. So better to avoid baby powders. Diaper creams you have to use compulsorily, and diaper free time you have to maintain. Whenever you change a diaper, remove the old diaper, clean the area, remove the apply the cream, leave for some time, then again you use for a next diaper. This is diaper free time you have to maintain. And wipes you can use, but it should not be chemically, like Bronopal content should not be present in baby wipes. And sunscreen lotions, as I said, till 6 months there is no need of applying sunscreen lotions. And soaps whichever you use, can apply gentle soaps which are suitable for the baby skin or babies. These all are the products, and especially my advice is whatever you are using the products should be herbal, so that it will not affect a baby's skin or any infection will not happen for a babies. And the next point is about the basic point, that is feeding. You have to feed compulsorily exclusively breast milk till if you have breast milk, you should feed compulsorily till 6 months. Breastfeeding only, no any other weaning items till 6 months, only breastfeed. If breastfeed is not there in some mothers, then you can go for the formula milk, that is formula powders we are getting like Lactogen, many other products we are having. You can go for that till 6 months, only milk, exclusively milk for a baby. After 6 months you can start with the liquid, that is dal water, rice water you can start. Then later you can wean a baby. Wean means extra supplements you can add, like maybe pedigree like ganji or fruit juices you can start after 6 months. So these all was the basic newborn care baby tips. Some may be thinking after seeing my video that these all points we were knowing what she is explaining, especially by making video, right? These are basic points which we have to follow. Whoever will not be knowing or whoever will be not be having idea of it, then they will get to know, right? So these are the basic steps. And another point I missed is the sign of baby filling the stomach. All new mothers will be asking, what is the sign that my baby is full, for how much time I should feed, right? Usually you can observe when baby is hungry, he will or she will hold his fist tightly, and while feeding also they will hold our sari or dress tightly, right? You may be observe, or if you didn't observe now, they will hold fist tightly. After taking feed, when their tummy is full, they will relax their hand. You can observe this. If they relaxed their hand by fixing the tightness, it is the sign that the baby tummy is full, so that you can stop a feed if baby is comfortable. So this was the basic steps which we have to follow in a newborn. I hope it will be helpful for new mothers and even for our BMS students in the point Navajata Shishu Paricharya, that is newborn care point in their syllabus. So if you want any such other topics, then you can comment in a comment section box. I'll go through it and make a video of it. Okay, thank you.